For the management of diabetes is the diet, the live exercise, that is the lifestyle modification. Monitoring the blood glucose is also equally important. Hello, my name is Dr. Ganavi. I'm working as Associate Professor and Consultant Endocrinologist at Ramaya Medical College and Ramaya Memorial Hospital. So today we'll talk about what precautions we need to take in order to prevent diabetes and also to prevent pre-diabetes. So the main management for diabetes, the four cornerstones for the management of diabetes is the diet, the live exercise, that is the lifestyle modification. Along with that, taking the tablets regularly is also important, and along with that, monitoring the blood glucose is also equally important. So we'll be dealing with all the four aspects in this particular session. So the first thing is the dietary modification. So what we advise all patients with diabetes is that their carbohydrate intake has to be slightly restricted as compared to before. So whatever patients, the rice intake or the carbohydrate intake, if they are taking at present, so if it can be reduced to half, and the protein intake, that is the dal, sambar, curry, which can be doubled, is definitely going to be helpful. Along with that, intake of salads, intake of green leafy vegetables, intake of legumes again is going to be helpful. So usually we advise the patients to follow what we call as a healthy plate method, wherein we advise the patients, if at all, if they are having food on a 9-inch plate or the diameter of the plate being 9-inch, half of this should be made up of green leafy vegetables. The rest quarter should be made up of carbs. Carbs, usually we advise patients to go off white rice if that's possible. If white rice is not the option, if the patient is not able to completely reduce white rice, so we ask the patients to reduce the quantity of rice, whatever they are consuming, to about half. Instead of white rice, they can go for red rice, brown rice. Millets are also a very good option, and even dalia or broken wheat is also a very good option. And as I said earlier, the rest quarter should be made up of proteins. So proteins, the good sources of proteins are mainly the eggs. The egg whites can be consumed. Chicken and fish also are good sources of proteins, but it is important that the chicken or fish should be grilled or steamed and not fried. Again, milk, curd, paneer are also very good sources of protein. So sprouts are again a good source of protein. So including all of this in your diet definitely is going to be helpful. And to be mindful about what we are eating every day, that is avoiding processed food in the form of pizzas, burgers, and along with that a lot of sweetened beverages, that is the cola, Sprites, again goes a long way in preventing diabetes. So apart from that, other processed foods like ice cream, chocolates also to be consumed to a minimum extent. So this is about the management dietary modification related to diabetes. So what are the exercise schedule we routinely recommend for patients with diabetes or for pre-diabetes or general as a whole to prevent diabetes include the following. So at least an individual has to be on a moderate intensity or a vigorous intensity activity, at least if it's a young individual, at least about 45 to 60 minutes per day of vigorous intensity. If it is an old patient, at least about 30 to 45 minutes of moderate intensity activity is important. It is not only for improving the blood glucose levels, but also the exercise in fact improves our cardiac function as well. It improves our muscle strength as well, because of which the falls and the fractures can be prevented. So exercising is very, very important. There are different types of exercises available for the management of diabetes. So there are aerobic exercises which includes swimming, running, jogging, and even badminton or other physical activities, or even brisk walking, and also cycling comes under aerobic activity. So there are other forms of exercise called the resistance training, which in fact helps in improving our muscle strength. So the push-ups, pulls, the use of dumbbells also can be utilized for this purpose. So, and if these machineries are not available, there are different, throughout our country we have parks wherein we have all the exercise equipments available. So definitely the push-ups and pulls also can be utilized, can be done with the use of these other equipments as well. So the resistance training in fact is recommended to be done at least 3 times a week, at least for about 10 minutes. 3 or 2 times per week is also sufficient. So that is about the exercise schedule. So now coming to the other cornerstone for the management of diabetes, that is being the monitoring of the blood glucose. So if an individual has diabetes, we usually advise patients to monitor their blood glucose, if they are on insulin, at least weekly 3 or 4 times. If they are on oral anti-diabetic drugs, that is the tablets, at least monitoring once a week or at least once in 15 days is what is recommended. So monitoring also plays an important role because the patients cannot go to the doctors every time. So monitoring at home with the help of a glucometer again will go a long way in keeping the blood glucose under control. So the next important management for the prevention of diabetes or its complications include the intake of the medications on a regular basis. So taking the insulin at the right time, at the right interval, and at the right dose in the right manner is also very, very important. So we have different patients coming to us with who are taking insulin irregularly, they're taking the insulin in a wrong way. Again, this causes the blood glucose to go very, very high. So also the tablets also have to be taken at the right time as well. It should be taken as prescribed by the doctor, either before food or after food, however it's been mentioned. And some of the patients also, those who are more than 40 years of age, might need to take cholesterol medications as well. So cholesterol lowering tablets in fact help in reducing the risk of development of heart attacks, strokes, as well as kidney problems as well. So it is important to take the medications on a regular basis. So this is related to the prevention of diabetes and also prevention of prediabetes. So regular diet, exercise, taking the medications regularly, timely monitoring of the blood glucose is very, very helpful. Thank you. And in the next episode, we'll be discussing about what the complications related to diabetes are if these measures are not followed. With that, I conclude. Thank you.